Madam Chair, ladies and gentlemen, dear colleagues, let me first thank you very much for the invitation to give a keynote presentation in this prestigious event. I'm deeply honored by it, and I also want to congratulate you for the new research strategy 2021-25. The title Health Research Making an Impact is something that we can all agree upon. One of the strategic objectives of your new strategy is to promote and enable the use of data to shape health policy, enhance the healthcare delivery, and drive broader research and innovation initiatives. This strategic objective has been very central in Finland for a few years now. But actually, the history of the healthcare information systems reaches back to the beginning of 2000s, when we had the first regional healthcare. One of your strategic objectives is to promote and enable the use of data to shape health policy, healthcare delivery, research and innovation. Finland is a small country in the northeastern corner of EU, and we have a population of roughly 5.5 million. Finland has valued this same strategic goal for a few years now. However, the history of the healthcare information systems is much longer, as the first regional systems actually were installed in 2002. Our health delivery system is very decentralized, or at least has been so, and that is actually the root cause for also the health information systems to be maybe more fragmented than would have been optimal. And therefore, we have been forced to build new overarching national information system parts to compensate for the decentralized original collection and storage of health information. The most important component of the national system is called Canta, which is a national repository for healthcare, social care and drug prescription data. It is available to professionals and citizens likewise, and it now covers almost entirely our healthcare services, increasingly also the social care services, and it also covers 100% of drug prescriptions these days. There is also a repository site for people's own personal health record information. The Finnish population, generally speaking, is very positive about the digitalization of all kinds of services, probably at least in part because we had the Nokia experience a few years ago. Actually, the Canta website has been voted to be the second most popular website in Finland. There are about 1.1 million logons every month, and about 10% of the population visit their own patient data repository, My Canta, every month. Finland has actually ranked many times at the top of different health and also other sector ICT comparisons in Europe. So we have had quite good healthcare data. Modern health research depends on and is based on the availability of high quality data. This idea is one of the reasons why the Finnish governments have been endorsing the so-called health sector growth strategy since 2014. The present government is actually the third or fourth in a row that has published strategy documents or roadmaps of how to make Finland a model country of sustainable health innovation activities, public-private partnership, and personalized healthcare, if you so will. The present government, led by Prime Minister Mrs. Sanna Marin, has also recently published the National Roadmap for Research, Development and Innovation, which actually repeats many of the basic principles and fundamentals of the so-called health growth strategy. I would like to highlight the last bullet point here, linking research and development activities to support renewal of the public sector and services. And here I find a very close connection to your new strategy, which emphasizes the benefits to the health and social care delivery that we can expect the research activities to produce. From the very beginning of the history of the health sector growth strategy, it has been a joint venture of the Ministries of Social Affairs and Health, Education and Culture, and Economic Affairs and Employment. And actually, it is not a single, very strictly defined strategy, but it's all about creating an ecosystem of many actors who work together to innovate and create value together. From the point of the healthcare delivery system, we started building centers of excellence, having in mind the fact that, for example, the university hospitals did not cooperate with each other in the best possible way. The relationships between companies and the publicly funded health system were not always smooth. And we wanted to involve the public, the patients, the staff, and make maximum use of the data that is available to all these stakeholders. The first real cornerstone of the ecosystem has been the Finnish Biobank network, which was founded by the Biobank law already in 2013. They are independent biobanks, mostly owned by university hospitals and universities, but they work together as a cooperative called FINBB, which has also a common web platform where you can find access to the data and sample collections that these biobanks own. Also, the sample collections from the large population studies are now available through the Finnish Biobank cooperative to investigators, be they academic or industrial. And as you can see, the number of biobank-based studies has been steadily increasing in Finland ever since this system has been in operation. Talking about data, which is very sensitive and personal by nature, we need special legislation to govern its utilization, both in research, innovation activities, and daily patient care. The Biobank law was the first, and the next very special piece of legislation is the new Genome Act, which has been around as an initiative for maybe too many years now, but it has been a rough road to go, and we finally hope that we will be able to submit the new Genome Act to the Parliament later this year. The fundamental ideas that are behind this legislation were already written in a working group draft document in 2015. If you are more interested in the difficulties, challenges, but also huge opportunities that genomic data provides, I can recommend the recently published policy brief by the European Observatory on Health Systems and Policies called Regulating the Unknown, a guide to regulating genomics for health policymakers, published just a few weeks ago. We actually continued from the document that was originally written based on the initiatives of the Italian EU presidency, and this theme was one which we wanted to introduce during our presidency during the second half of 2019. The Finnish Biobank law has actually been totally updated and is under public consultation right now. One of the reasons has been that from genomic research, the biobanks have received data that has some value to the individuals and to their care providers, but there has been no legally appropriate way to mediate this information to the Canta patient repository or to the doctor's offices. And so one of the new paragraphs in the biobank law and the forthcoming genomic legislation will be the rules and regulations for handling unexpected observations as well as expected observations from all kinds of studies involving genome analysis. Colleagues, so far I have mostly discussed how the health growth strategy ideology has helped us to be better prepared for the new kinds of information and data that are being generated both in health research and in our everyday life. But we have also realized that we need to improve the infrastructure that delivers the data to our patients and the benefits from the data, as well as enables us to collect up-to-date, relevant data from our patients and health system operations. So one of the cornerstones of the health growth strategy has been to bring together the university hospitals, research institutes and investigators to clusters of national excellence. And it has not been an easy task, I have to say, because you know that the academic world is very competitive, and realizing that we also have mutual benefits is something new to us all. The first real achievement in this part of the health growth strategy has been the generation of the Finnish Cancer Center, which brings together all cancer hospitals in Finland, is backed by a government decree and a cooperation agreement, and has also received some seed money from the government. We will see how this new flagship will fly, but at least it's now there as an official organization and is supposed to represent the cancer care community and the patients and bring forward the best possible care and to facilitate clinical research in this very rapidly moving area of medicine. Another center of excellence is the Finnish Neurocenter, which is more university-led. The Cancer Center was more healthcare university hospital-led, but this is led by academic research institutions, which illustrates quite nicely that not all these centers of excellence need to be similar, but what is fit for purpose is the way to go. And it also highlights how useful it has been that we are 3 different ministries and actually 2 different funding organizations, the Academy of Finland and Business Finland, who form the backbone from the side of the government. This slide shows the current national information systems architecture for health and social welfare. I'm not going to describe it in detail, but more or less the question from now on is that, fine, we have access to data, and it has in a way changed it all already, but what next? How can we make maximum use of all this information? And if you pay attention to the upper right-hand corner of the graph, you also notice that there are apps. People produce information themselves. How are we going to be able to make use of this very valuable information that we so far have not had access to? Legally, the primary and secondary use of personal data are two different entities. To be able to maximally utilize the databases, the registries, and in the future also data collected by individuals, we have installed the so-called legislation for secondary use of health and social data, which has been in action for more than a year now. So from the sources of data collected for primary use, this legislation allows, under strict rules and regulations and safe and data secure procedures, for the secondary use of data based on the Act and operated by a new authority called FinData. The Act defines purposes for the secondary use of health and social data for scientific research, statistics, development and innovations, teaching, knowledge-based management, and last but not least, authorities' steering, supervision, planning, and reporting duties. This slide shows the goals of the new legislation and the new authority, FinData. Eliminating overlapping administrative burden was one of the driving forces of this new legislation. But in fact, over time, it has become more and more evident that we need to improve the quality of the data that has been stored in population study registries as well as in the Canta patient archive or repository. And this is because even if much of the data is already structured, it is not enough for the purposes of the secondary utilization of these data sources. We need to improve the structured data storage procedures and give instructions even to the practitioners and to administrators about how to collect, how to process, and how to timely store the data in the registries and in the Canta patient archive repository. Gathering all the operations described in this slide in the hands of the FinData authority has been a major effort, has not been without resistance from the individual registry keepers, not to say a word about academic researchers, but is actually an absolutely necessary thing to do, because this is how we can fulfill the requirements of the GDPR in the secondary use of health and social data. We are aware that there are attempts, legislations, institutions in other EU countries who aim at the same, but it is our understanding that the recently launched joint action towards the European health data space has regarded Finland as a model country and our legislation on the secondary use as a model legislation. And we are very proud that Sitra, the Finnish Innovation Fund, has the honor to be the coordinator of this newly launched and very ambitious joint action. And I'm also happy to notice that Ireland is involved in this joint action. This slide is quite busy, but it tries to illustrate the expected outputs of this joint action. I would like to comment these presumed outputs by saying that one size does not fit all. Countries are not on the same level playing field to begin with, and they need not end up in exactly similar systems. But the systems reflect their healthcare organizations, the funding models, and national culture. But we need to find a minimum common denominator to serve our people so that they can move across the borders as data moves across the borders. And definitely academic research has moved across the borders already for a long time. Towards access to at least 1 million and probably many more sequenced genomes in the EU by 2022 is one of the projects that feeds into the European health data space concept. Probably, and this is my personal view, our ability as ministries and healthcare administrators to engulf genomic information in our databases and healthcare practices is a stress test that shows how well we can follow scientific progress. Genomic medicine, genomic information is there, no question about that. Question is who owns it, who can make use of it, who can afford it, and who benefits from it. And these are public health issues that need to be tackled together and preferably on the EU level. The current COVID-19 crisis has, of course, been another stress test, both for our health systems and for our research communities. Finland, being a highly digitalized country, adopted the corona contact tracing app Koronavilkku really quickly. About 40% of the population is now actively using it. And so people get positive feedback for digital services. But at the same time, we have realized that our patient record system does not allow up-to-date and timely follow-up of the health system's performance, capacity, personnel, service gaps, and so on. So it has really illustrated that also our system needs improvement. At the same time, we have realized that we are not making maximum use of telemedicine, digitalized services. And I personally think that if, for example, our tax organizations, authorities, businesses have developed digital customer services, why don't we do that in healthcare? There's plenty of room for improvement. And I think that also our patients, our customers, gradually start demanding it. Dear colleagues, in this presentation, I have very briefly and maybe superficially touched upon some of the features of the Finnish health and social care system and the research and innovation ecosystem which builds upon it and is also providing us as healthcare authorities invaluable information and options for growth. You might have wondered why I haven't spoken much about money. The Finnish government has supported the health growth strategy by budget money, which is not horrendously much, but it is very symbolic and necessary seed money for many of the centers of excellence and projects which I have described in this short presentation. But above all, it's a question about how to support and facilitate the generation of regional and national ecosystems. We cannot force them top-down. It is at the same time a bottom-up and a top-down exercise. It's a joint venture of many stakeholders, but from the ministry civil servants' point of view, I cannot underestimate how much I have needed different professionals, medical experts, legal experts, ICT experts, in making all this happen, even to that degree that we have been able to achieve so far. It's all about trust between us, stakeholders, the population, but it doesn't really bring us anywhere without the backing support of the government and the necessary legal background. The most important trust is needed. Dear colleagues, this is an old slide that I have been showing for many years, and it still holds true. Data will transform health systems, and the transformation is delivered by medical research and evidence. Building a sustainable ecosystem that delivers is a joint venture. We need to provide the legal and ethical principles, an open, innovative environment for public-private partnership, and we are absolutely dependent as ministries on wide expertise from medical, legal, and ICT experts. We need all your help. It's also very important that we facilitate open interaction and dialogue between the basic science, translational research, clinical science, healthcare provision, and public health experts. I thank you very much for your time and interest in the Finnish system, and I'm very happy to entertain questions. And congratulations and good luck to you in Ireland.